What if the vitamins you take each morning, so carefully, so routinely, were doing more harm than good? It's a thought that might feel uncomfortable, but if you're over 60, your body doesn't respond to supplements the way it once did. Some of the very nutrients that used to help can quietly turn toxic over time. They build up in your system. They stress your organs. They may even mimic the symptoms we often chalk up to just getting older. But here's the encouraging truth. You're not powerless. Once you understand which vitamins to avoid and which ones to embrace, you can take back control. You can support your body, protect your mind. Give yourself the chance to age with strength, clarity, and calm. Today, we'll explore 4 vitamins that many seniors are still taking, even though the risks far outweigh the benefits. And we'll also highlight 4 essential nutrients your body likely needs more of every single day. The difference between feeling foggy or focused, stiff or strong, may come down to just one label on a bottle. Let's begin this journey together. It's not about fear, it's about feeling empowered. After the age of 60, everything changes just a little. Your digestion slows. Your liver clears substances more slowly. Your kidneys don't filter as efficiently. And because of that, your body processes vitamins and minerals differently than it did at 30 or 40. What was once helpful can now start to quietly backfire. Many seniors continue taking the same multivitamins they've used for decades, without realizing how much their body's needs have shifted. Some nutrients can build up in your tissues. Others may interfere with absorption. A few may even affect your heart, your brain, or your nervous system if the dose or form isn't right for this stage of life. This is not about cutting everything out. It's about knowing which supplements support your aging body and which may be slowly wearing it down. In the next sections, we'll walk through the 4 most dangerous vitamins to avoid after 60 and the 4 most essential nutrients to include daily, so you can feel energized, clear, and supported. By the end, you'll understand how small adjustments can make a lasting impact on your comfort, clarity, and well-being. Let's begin with the first group, the vitamins that may be quietly doing harm, the ones we'll want to reconsider, starting today. Vitamin A plays an important role in our health. It helps keep your eyes sharp, it supports healthy skin, and it strengthens your immune system. For many years, vitamin A was considered a nutritional hero. Because of this, it's included in many multivitamins and supplements. However, as we age, our bodies process vitamin A differently. There are 2 key forms of vitamin A you should know: retinol and beta-carotene. Retinol is the active form found in most supplements. It is fat-soluble, meaning it dissolves in fat and is stored in your liver and fatty tissues. Unlike water-soluble vitamins such as vitamin C or B-complex, retinol is not easily flushed out of the body. As your liver function slows down with age, it can no longer clear retinol efficiently. This causes vitamin A to build up in your tissues over time. Too much retinol can quietly cause serious health issues. Many people do not realize this buildup happens slowly. Symptoms often appear mild and are mistaken for normal aging. You might notice your skin becoming dry and flaky. Occasional dizziness may occur. Your vision could become blurred or less sharp. Joint pain or stiffness might increase. In severe cases, heart rhythm problems can develop. A large 2022 study found that older adults with excessive vitamin A had a 25% higher risk of atrial fibrillation. This is an irregular heartbeat that can lead to stroke and heart failure. This risk makes vitamin A toxicity a serious concern for seniors. It's easy to consume too much without knowing it. Retinol appears in many multivitamins and supplements. It's also present in liver and liver-based products. Women over 60 should aim to keep retinol intake below 700 micrograms per day. Men should not exceed 900 micrograms per day. Consistently going over these amounts can be harmful, but not all vitamin A is dangerous. Beta-carotene is a safe and natural precursor to vitamin A. You find beta-carotene in colorful fruits and vegetables. Carrots, sweet potatoes, spinach, kale, and eggs are excellent sources. Your body converts beta-carotene into vitamin A only as needed. This self-regulating mechanism prevents harmful buildup. Imagine beta-carotene as a smart faucet. It only releases vitamin A when your body is thirsty for it. Because of this, beta-carotene does not accumulate or cause toxicity. Getting vitamin A from food ensures a safer, balanced intake. Whole foods also provide fiber and other nutrients that help your body process vitamins efficiently. Eating a diet rich in beta-carotene supports your vision, skin, and immune health without the risks of overload. Practical tips for managing vitamin A. If you're over 60, here are some steps to protect yourself. Check your supplements for retinol or retinyl palmitate. Avoid exceeding recommended daily limits for vitamin A. Focus on eating a variety of colorful fruits and vegetables. Discuss your vitamin A intake with your healthcare provider. Monitor symptoms like dry skin, dizziness, joint pain, and vision changes. Taking control of your vitamin A intake can help you feel clearer, move easier, and protect your heart. Emotional reflection. Think of your body as a garden. When you water it carefully, it flourishes. But if you pour too much water in one place, the roots can drown. Retinol overload is like too much water flooding your garden. It damages delicate roots beneath the surface. By choosing beta-carotene from natural foods, you water your garden gently and wisely. You nurture your health with care and balance. Next, we'll explore iron, a nutrient often taken with good intentions. But after 60, too much iron can quietly harm your organs. Iron is a mineral your body needs. It helps make red blood cells. These cells carry oxygen to your organs and muscles. Iron supports your energy and overall health. Many people believe taking iron supplements is harmless or even helpful. But after 60, your body handles iron differently. Men stop losing iron after puberty. Women stop losing iron after menopause. This means iron starts to build up inside your body. Unlike vitamins that flush out easily, iron is stored mainly in your liver, heart, and pancreas. Too much iron causes oxidative stress. Oxidative stress damages your cells and inflames tissues. It ages your organs silently from within. This process can contribute to serious diseases. These include Alzheimer's disease, heart conditions, and cancer. The problem is many seniors take iron supplements without needing them. If you have anemia or blood loss, iron supplements may be necessary. But most seniors get enough iron from their diets. Foods like meat, beans, leafy greens, and fortified cereals provide iron naturally. Adding extra iron through supplements can cause overload. Symptoms of iron overload are often subtle. You might feel tired or weak. You may notice joint pain or memory problems. Your heart could beat irregularly. These symptoms are often mistaken for normal aging. That's why it is important to check your iron levels. Ask your healthcare provider for a serum ferritin test. Also ask for transferrin saturation testing. These tests measure how much iron is stored in your body. If your iron stores are high, it's time to cut back. Reduce iron supplements. Cut down on red meat and other high-iron foods. Too much iron is like adding fuel to a slow-burning fire. It puts extra stress on your organs, which are already aging. Practical advice for managing iron. If you take a multivitamin with iron, check the label carefully. Talk to your doctor about your iron status. Only take iron supplements if blood tests show you need them. Avoid taking iron just in case. Your body's ability to manage iron changes as you age. Being cautious can protect your brain, heart, and liver. Emotional reflection. Think of iron like a useful tool in a toolbox. When used properly, it helps build and fix things. But if you use too much of it, it can cause damage instead. After 60, your body needs less iron than before. Giving your body only what it needs keeps the toolbox balanced and your health strong. Next, we will look at calcium, a vitamin many seniors take to protect their bones. But too much calcium can be harmful in unexpected ways. Calcium is well known for supporting strong bones. For decades, seniors have been told to take calcium supplements to prevent fractures. It appears on almost every bone health advertisement. But calcium is more complicated than it seems. After 60, your body processes calcium differently. Your bones do not absorb calcium as efficiently. Hormones and growth factors that once helped regulate calcium slow down. This means excess calcium does not always go where it should. Instead of strengthening bones, extra calcium can deposit in soft tissues. It can build up in your arteries. This is called artery calcification. Artery calcification stiffens blood vessels. It raises the risk of heart attack and stroke. Many seniors taking calcium supplements are unaware of these risks. A growing body of research links excess calcium supplements to increased cardiovascular events. Calcium pills can also cause digestive problems, bloating, constipation, and poor absorption of other minerals like zinc and iron. If you take acid blockers for reflux, common in seniors, your stomach won't absorb calcium properly anyway. This means the benefits of supplements may be less than you expect. Getting calcium safely. The best way to get calcium is through food. Leafy greens like kale and collard, sardines with bones, yogurt and other dairy products, almonds and chia seeds. These foods provide calcium in forms your body can absorb better. They also provide other nutrients that help bone health. If you do take calcium supplements, make sure they include vitamin D3 and vitamin K2. These vitamins help direct calcium into your bones, away from your arteries. Be mindful of how much calcium you consume in total. More is not always better. Balance and quality matter most. Emotional reflection. Think of calcium like water flowing through pipes. When pipes are clear, water reaches the right places. But if too much water flows or pipes are clogged, damage occurs. Too much calcium can clog your arteries. But with balance, calcium keeps your bones strong and your heart safe. Now, we will discuss vitamin B6, a vitamin often taken for energy and nerve support. But high doses after 60 can cause serious nerve damage. Vitamin B6 is often seen as a simple helper. It supports energy. It helps nerves function properly. Many seniors take B6 supplements daily. They believe it keeps their brain sharp and reduces fatigue. But after 60, too much vitamin B6 can quietly harm your nervous system. B6 is a water-soluble vitamin. Usually, excess water-soluble vitamins flush out of the body, but vitamin B6 is different. In high doses, it can build up in nerve tissues. This buildup is toxic. It damages your sensory nerves. You may feel tingling or numbness in your hands and feet. Burning sensations and muscle weakness can develop. Balance problems might appear. These symptoms often mimic aging or diseases like diabetic neuropathy. Many seniors and doctors miss that vitamin B6 toxicity is the cause. How much vitamin B6 is safe? The official upper limit for vitamin B6 is 100 milligrams per day. but research shows even 50 milligrams daily over time can cause toxicity in older adults. Many supplements contain more than this in one serving. Stacked with multivitamins and fortified foods, your total intake can easily become harmful. Once nerve damage occurs, recovery is slow and sometimes incomplete. Older adults are especially vulnerable because of slower metabolism and existing health conditions. How to protect your nerves? You still need vitamin B6, but only in small amounts. The recommended daily intake is 5 milligrams for women. For men, it is 7 milligrams. Most of this can come from foods like chickpeas, tuna, turkey, bananas, and fortified cereals. If you take supplements, check the label. Avoid doses over 5 to 10 milligrams per serving. Consider switching to senior-specific formulas, or consult your healthcare provider for blood tests to check your B6 levels. Emotional reflection. Think of vitamin B6 as a helpful messenger. In the right amount, it delivers important signals in your body, but too many messengers cause confusion and noise. That noise can harm your nerves, making simple tasks harder. By controlling your vitamin B6 intake, you help your body communicate clearly and smoothly. Next, we'll explore magnesium, an often overlooked mineral, but vital for sleep, muscles, and mood in seniors. Magnesium is one of the most important minerals for your body. It supports over 300 enzyme reactions. It helps regulate your blood pressure. It keeps your nerves and muscles working well. It stabilizes blood sugar levels. Magnesium also plays a key role in keeping your heart rhythm steady, and it supports brain function. Why magnesium matters more after 60? As you age, your body loses magnesium more easily. Your absorption decreases. Your kidneys waste more magnesium. Common medications like diuretics, acid blockers, and blood pressure pills speed this loss. The result? Many seniors have low magnesium levels. Low magnesium causes fatigue and muscle cramps. It can lead to poor sleep and anxiety. Irregular heartbeat and insulin resistance may develop. These symptoms often creep in slowly. They are mistaken for normal aging. Benefits of restoring magnesium. When magnesium levels improve, seniors report better sleep. They notice fewer muscle cramps. Balance improves. Some even experience sharper thinking. Studies link magnesium deficiency to dementia, atrial fibrillation, and type 2 diabetes. Choosing the right magnesium supplement. Not all magnesium supplements work equally well. Magnesium oxide is common but poorly absorbed. It often causes digestive issues. Better options include magnesium glycinate, magnesium citrate, and magnesium malate. These forms are gentler on the stomach. They are better absorbed by aging digestive systems. How much magnesium do you need? Ideal doses vary. Many seniors benefit from 250 to 400 milligrams per day. Diet can add magnesium through leafy greens, avocados, pumpkin seeds, almonds, and black beans. But soil depletion means food magnesium is often lower than before. Supplements become necessary, especially if you take medications that reduce magnesium. Emotional reflection. Think of magnesium as the conductor of an orchestra. When magnesium is balanced, your body's systems play in harmony. Without it, the music becomes chaotic. Restoring magnesium brings rhythm back to your life. Next, we'll discuss vitamin D3, a vital nutrient that acts more like a hormone, essential for bones, immunity, and mood. Vitamin D3 is not just a vitamin. It acts more like a hormone in your body. It regulates calcium and phosphorus. It supports your immune system. It helps maintain strong bones. And it plays a key role in brain function and mood. Why vitamin D3 levels drop with age. As you get older, your skin produces less vitamin D3 from sunlight. By age 60, production can drop by more than half. Many seniors spend more time indoors. They may wear sunscreen or live in northern climates. All these factors reduce natural vitamin D3 levels. Low vitamin D3 can cause fatigue, muscle weakness, and bone thinning. It also weakens your immune defenses. Research shows seniors with low vitamin D3 have a 50% higher risk of respiratory infections. They also have a 30% higher risk of death from all causes, including heart disease and cancer. How much vitamin D3 do you need? Most adults need 600 to 800 IU per day, but many seniors require 1,000 to 2,000 IU daily to maintain healthy blood levels. If your levels are low, your doctor may recommend higher doses temporarily. Choosing the right vitamin D3. The best form to take is cholecalciferol, or D3. It is better absorbed than D2. You can find it in liquid, soft gels, or capsules. Take it with a meal containing fat for better absorption. Benefits beyond bones. Vitamin D3 helps regulate your mood. It supports memory and cognitive function. Low vitamin D3 is linked to depression and increased risk of dementia in seniors. Maintaining healthy vitamin D3 levels supports brain health as well as physical health. Emotional reflection. Think of vitamin D3 as the sunshine your body needs. Just as sunlight warms and nourishes plants, vitamin D3 warms your bones, your heart, and your mind. Without enough sunshine, both plants and people suffer. By keeping your vitamin D3 levels balanced, you keep your inner light bright and strong. Now that we've covered the essential vitamins to avoid and to take daily, let's wrap up with a reminder about making smart choices for your health. You've just learned about vitamins that can either help or harm after 60. Some supplements may quietly drain your strength. Others can support your brain, heart, and body. The difference lies in choosing wisely. It's not about taking more. It's about taking smarter. You deserve to feel vibrant, clear, and strong. Every day is a chance to give your body what it truly needs. Start by checking your supplements carefully. Focus on nutrient-rich foods. Listen to your body. Talk to your healthcare provider. Make small, consistent changes. These steps can add years of vitality to your life. Remember, aging is a natural process to be embraced, not feared. With the right knowledge and choices, you can thrive well into your 70s, 80s, and beyond. Thank you for joining this journey today. Your health is your greatest asset. Choose wisely. Live fully. Now, here's a question for you. Which vitamin surprised you the most today? Or which change will you try first? Please share your thoughts in the comments below. I read every message and look forward to hearing your story. If this video opened your eyes, please like and subscribe. Hit the bell icon to get notified about new videos that help you live stronger longer. Take care and see you next time.